Hello, my name is Nick Reedhead. This is Nursing 355. This is my patient Drake, and we're going to be assessing the neck vessels and the heart. Okay? Wash my hands. Hello, Drake. My name is Nick Reedhead. I'm your nurse today. We're going to be inspecting your neck vessels and your heart. Okay? Okay. So first thing that I'm going to do is throughout the assessment there will be different position changes throughout the assessment. And I will be palpating, auscultating, and visualizing. First off, I'm going to raise the bed up a little bit more so that you're in between the 30 and 45 degree angle. Okay, that's about 45 degrees right there, 30, 45 degrees. What I'm going to be doing first off is I'm going to be visualizing the jugular veins. There's an external and an internal. Mainly whenever I do so, Drake, if you can look to your left, okay? I'm looking for just any jugular vein distension in the external vein. I'm also going to be trying to visualize for any palpation of the internal jugular veins. I don't see any pulsating. I don't see any neck distension. If you can't see any pulsating, sometimes you can look. If you want to look straight up now, Drake. You can also see the internal, or sorry, in the suprasternal notch. You can also at times see some pulsation going on right in this area. But if you look to your left, Drake, go ahead. The external vein is flat. There's no distension. If it is distended, it could indicate right-sided heart failure or pulmonary hypertension. So next, what I'll do, I'll go to auscultation, and I want to do auscultation before I do palpation because if palpating the carotid artery could cause the heart rate to speed up or slow down, and that'll affect my auscultation. And so first off, what I'll do is I will use the bell end of my stethoscope. I will ask the patient to hold their breath so that the trachea doesn't, the breath sounds moving through the trachea doesn't affect my auscultation. So Drake, if you could hold your breath for me, please. Okay, and what I'm listening for is a bruit or a thrill. Okay, now take a breath, Drake, and look to your to my side. Okay, now hold your breath. Okay, if you look straight now. Thrill can be, the bruit. I'm looking for a bruit, or because it can be indicate narrowing of the vessel, which could be arteriosclerosis. And next, I'm going to be doing palpation. When I'm palpating, what I'm looking for is I'm testing for the elasticity of the vessel. If it's firm, that can also mean arteriosclerosis. I'm trying to feel for a thrill. Thrill is indicated in the book as purring of like the purr of a cat. And so what I want to do is I want to use the pads of my fingers, my index and my middle. And what I'll do is I'll just palpate right here in the carotid, and I'm feeling for the quality of the pulse as well. And he has good pulses. Vessels feel elastic, and I don't feel any thrill. Okay. Main thing with the auscultation, the palpation is if I suspect cardiovascular disease, which mainly I would do on a patient that's middle age or older. But on a young patient like Drake, it's not as necessary. So now I will move to the cardiac. On the cardiac assessment, first off is you want to start by inspecting. Mainly you want to inspect in the apex of the heart, which is the fifth intercostal space, midclavicular line. You want to look for any pulsations, and Drake's for privacy, we're keeping his shirt on. So now we'll move to the auscultation. In the auscultation, there are 5 locations. There are the aortic, which is the substernal border on the right side. Then you move to the pulmonic, which is the left sternal border, second intercostal space. Then you move down to the third intercostal space, which is the Erb's point. Then you move to the fifth intercostal space, which is the tricuspid. Then you move to the midclavicular line of the fifth intercostal, which is right here, which is the apex of the heart, point of the maximal impulse, where it should be heard the most. And the sounds that I am listening for, normal sounds is S1, S2, which is a lub dub. Abnormal are S3, S4, which are other heart sounds that are heard. Then you're also looking for any clicks, any murmurs, any abnormal swishing noises. So I'll go and I will perform the auscultation. So Drake, what I'm going to do is put the stethoscope on you and listen to 5 different areas. Okay, I didn't hear any abnormal clicks, any murmurs, heard a clear lub dub. Okay, now I will go to palpation, and I will palpate mainly the apex of the heart. What you want to feel is a slight tap in the fifth intercostal space, midclavicular line. And if you don't get a good feeling of it, sometimes with the older patients, you won't feel it as well. So what I can do is I can have you, Drake, if you want to lay over to your left lateral, get in the left lateral position. And what it does is it pushes the heart to the closer to the chest wall. And so you feel right there in the fifth intercostal space, midclavicular line. And you feel a tap. And you can do the same when you're auscultating as well. If you can't hear the apex of the heart is strong, you can have them lay in this position, and you can auscultate. Okay, Drake, you can get back to your side. And this concludes my assessment of the neck vessels in the cardiac.